welcome to the Morning Watch on Love 101 FM. I'm your host, Dylan Toussaint. A special welcome to our listeners on love101.org, and if you're overseas and on the move. U.S. listeners can access us at 712-832-8001. And if you're in the UK, 0330-332-6541. Or join us via the Love 101 FM app that can be downloaded from the Google Play Store or the Apple Store. You can also join us on Love 101 FM Facebook and YouTube Live. In the first watch today, is it a cold, the flu, or something else? And in the second watch, when stray animals endanger motorists. For our social media question, we ask, when you start feeling flu-like symptoms, what's the first thing you usually do? We're asking you to share your responses on our Love 101 FM Facebook page and YouTube channel, and also on WhatsApp, 876-997-3125, using the hashtag The Morning Watch. We'll share your responses later on in the program, but before all of that, here's I quote.
All right, good morning. Today's I quote says, health is not valued till sickness comes. And this one is from Thomas Fuller.
Yeah, short and spicy there, Jokal. Mm-hmm. Good morning to you, sir.
Good morning.
Yeah, according to the producer, in other words, we don't see the value of our health until it starts to decline. And my little concept is our greatest wealth is our health. The first watch after this break.
Can you believe it? Love 101 is celebrating 33 years of goodness, and we're excited. Join Love 101 for the 33rd anniversary celebration service. Let your light shine. Sunday, February 8th at 10 a.m. at the Filippo Baptist Church, 9 William Street, Spanish Town, with host Pastor Reverend Carl Johnson, the new chairman of the National Religious Media Commission, owners and operators of Love 101 FM. 33 years of goodness, 33 years of letting our love light shine. Join us in person if you can on Love 101 Radio or our social media platforms. It's a 33rd anniversary celebratory church service, Sunday, February 8th, 10 a.m. And it will be live on the family station, Love 101.
On the next mailbox, we'll be staying on track with the topic Steaming Ahead Part 2. Imagine starting your high school journey with an avalanche of financial challenges. These financial problems caused you not to have a roof over your head at times, along with a poor school attendance record and low academic results for almost 3 years. You are invited to continue the conversation with our special guest, Mr. Eric Cunningham, second-year physics student at the Michael University College, as he shares more about his divine transformation, graduating with 16 subjects and recognized with an iconic photograph atop the San Diego High School sixth form block. That's Wednesday, February 4th at 5:30 p.m. on the family station, Love 101, the mailbox, Monday.
Wake up with the Word Box on Love FM, your morning boost from the Word of God. Brought to you by Word Intercession and Worship Center, the church where love abounds. Located at 7 Nelson Street, Maypen, Clarendon. We're on every Thursday morning at 5:45 with real encouragement and truth to start your day right. The Word Box. Fresh word every Thursday morning, only on Love FM.
Word in our hearts, and the praise in our mouth. We are ready to. There is hope.
Life can feel overwhelming at times, but you don't have to face it alone. The Ministry of Counseling and Prayer of the Edgewater Baptist Church is here to support you with our caring and confidential telephone counseling service. Whatever you're going through, grief, stress, family challenges, or just feeling stuck, our trained counselors are ready to listen, pray, and guide you toward hope and healing. Take the first step today. Call us at 876-220-6474 or 876-332-7956. Weekdays between 8 a.m. and 9 p.m. Saturdays and Sundays between 8 a.m. and 8 p.m. Help is available through the Prayer and Counseling Ministry of the Edgewater Baptist Church. Remember, help is just a phone call away. That's 876-220-6474 or 876-332-7956. Weekdays between 8 a.m. and 9 p.m. Saturdays and Sundays between 8 a.m. and 8 p.m. Call now and let us walk this journey with you.
Happy, 'cause you have strayed.
Welcome back to the Morning Watch. Thanks for staying with us. I'm your host, Dylan Toussaint. Now, according to a recent Gleaner report, the Ministry of Health is encouraging Jamaicans to take flu symptoms seriously and to get vaccinated, especially as the island experiences a peak in flu cases. Now, many people often dismiss early symptoms as just a cold, but medical experts warn that influenza and other respiratory illnesses can lead to severe complications, especially among the elderly, children, and persons with chronic conditions. Well, to help us better understand the differences, the risks, and the prevention strategies, we're joined this morning by Dr. Garth Rattray, who's a medical doctor, and Dr. Ernestine Watson, chairperson of the Jamaica Pharmacy Council. Good morning to you both.
Morning.
Morning. Dr. Rattray with us?
Yes, sir.
Okay, good. Good to have you both with us again. I begin with you, Dr. Rattray. Is there really a difference between a cold and the flu? And if so, what is or what are the differences?
Okay, so there's a big difference.
Mm-hmm.
I recall seeing a little joke where they show a little toy train in a child's home and said, "This is the cold." And then you see this huge locomotive. This is the flu.
Mm-hmm.
The big difference.
Okay.
They're both caused by viruses, but the cold is something called a rhinovirus. RHINO, like rhinoceros nose. Sniffles, maybe a little fever, sneezing, uncomfortable feeling. But a flu is body aches, high fever, puffiness. It can cause complications, chest infections, ear infections, organ problems, and it's potentially lethal. It's a huge difference between both of them. And flu is actually going around.
So, if I'm hearing you correctly, the flu is the more serious of the two.
That's right.
Yes, and isn't it possible that you can have both?
It is possible, but in that case, you wouldn't even know you have a cold.
You wouldn't know you have a cold.
Super suited. That's right. If you went to put them together, you would know there are different viruses, and the flu is far more aggressive.
Okay. Dr. Watson? Dr. Ernestine Watson with us? Not hearing her at all. Dr. Watson? Are you muted? All right. Not sure what's going on there. We want me to reconnect with her. Still with you then, Dr. Rattray.
Yes, sir.
Yes. What are the worst case scenarios in terms of someone catching the flu? Therefore.
Well, this, that's one.
Mm-hmm.
It's called organ failure, systemic failure. You can get chest infections, pneumonia, for instance, in one of two ways: directly because of virus, or you can weaken your immune system and you get a secondary bacterial infection. People who are immunocompromised can get a flare with their diabetes. They can get brain infections, ear infections, sinus infections. Can make you very sick. That's the worst case scenario.
Mm.
If you want to know what can happen, usually misery, high fever, cough. If the cough is productive, you might need something for it. It can last up to 2 weeks as a cough.
Mm.
But generally, flu symptoms last up to about a week. And most people get over it in about 7 days, although they'll feel what the Americans call pop down or mash up for about 2 weeks.
Mm.
If you want to treat it, you're treating basically the symptoms. I must say here that people should be careful because people take acetaminophen, Panadol, Cetamol, but if you take too much, it can cause liver damage, which happens a fair amount during chikungunya, correct. So if you read the labels very carefully, try to avoid what they call NSAIDs, like the other pain tablets people take, because it can cause problems too. Stick to Panadols or Panadine, but follow the dose. Hydration, rest, stay away from work because you can spread it.
Mm.
Another thing I want to mention here is that, strictly speaking, if a child gets a flu, they should stay away for 2 weeks. People don't do that because school is not only school, there are also like daycare centers. And that's why you find it spreads so much in schools because the children go back and they're very close and therefore they spread it around a lot.
Yeah. And well, let me just double check. Dr. Watson, are you with us? Dr. Ernestine Watson? Still having difficulty. All right. Dr. Rattray, the flu vaccine. What is your take on that?
You should definitely get it. It's a regular sort of vaccine. They use an egg media to grow it in.
They use a what, sir? Use a what, doc?
Egg media, EGG media.
What's that?
Egg, eggs that cows lay.
Yes.
I thought they grow the virus in.
Okay.
But if you are allergic to eggs, don't take it. But the vaccine is made from a virus that has been inactivated. And then they purify it and give it the actual inactivated virus. So your immune system, take about 2 weeks, will learn how to kill it off. They use surveys to decide what viruses you're going to need for that year, which is usually from about November until about March. But the thing about it is that it works pretty well. So take it because it can prevent or reduce you getting the symptoms of the flu. It's very important, especially in the high-risk groups, young, elderly, which is 65 and above, people who are on medication that can depress their immune system, people who have a depressed immune system, and therefore you should really take the vaccine. People don't do it a lot. I think it's become worse since COVID. That whole vaccine controversy has made people become afraid of vaccines. So, but it's very important that people take it because it is a very good vaccine. It's been around for a long time, and it works fairly well.
Are there not possible side effects, reactions to persons being vaccinated with the flu vaccine vis-a-vis other medication that they may be taking?
No, not for other medications. But anything you do, any vaccine can have side effects.
Mm-hmm.
Anything ranging from a spelling, itching, fever, to something more serious like a person getting shot up and so on. I have never seen the latter one. It's been around for a long time. People give it to people all ages, and the older, the more you forget it. So it's not something you could react with medication that you're taking.
Yes. Just to get it clear, I mentioned about the egg stuff earlier.
Yes.
How would you know that, you shouldn't take it in that regard?
So if you're a person who, when you eat egg, you get it itching all over or something, then you shouldn't take it. Again, it's very rare, but people are allergic to a lot of things.
Mm-hmm.
Usually you know beforehand that you are allergic to egg. Just no, you can't take it.
Mm. Okay. All right. Stick a pin right there. We are up on a break, and hopefully when we come back, we can have we'll have Dr. Watson on. Soon be back.
Mama work hard, for real. She do the most to send me and my brother go school. So, the dream was always to go to university. Well, I fulfilled 2 dreams with 1 Jane Bank savings plan, I further my education and I make mama proud.
Save so you can make the part, travel part, graduate like a star.
Stop wishing you could. With your Jane Bank savings, you absolutely can. Jane Bank will help you find a way.
Worship and Faith International Fellowship WAFIF presents International Debt Burning and Financial Empowerment. Sunday, February 8th, join us at 6 p.m. at 55A Old Harbor Road, Spanish Town, St. Catherine. Take along copies of your debts to be burned and 10 things you're believing God for. Those will be prayed over and lifted up before the Lord.
There's a fire blazing outside.
Welcome back to the Morning Watch. Thanks for staying with us. I'm your host, Dylan Toussaint. And it's the first watch. We're asking, is it a cold, the flu, or something else? And in so doing, we have online Dr. Ernestine Watson, chairperson of the Jamaica Pharmacy Council, and Dr. Garth Rattray, who is a medical doctor. We're hoping that we have touched base now with Dr. Watson. Doc, are you there? Dr. Watson? Okay, still having some difficulties there. Dr. Rattray still with us?
I hope so, sir.
Okay. All right. What are your recommendations, Dr. Rattray, or concerns re the use of home remedies vis-a-vis, the other things that you have mentioned earlier?
Okay, so yes, most colds, since you're mentioning colds and flus, are treated by home remedies.
Mm-hmm.
The only thing people really need to do is to rest, hydrate, and take something for the fever and, of course, the body pains. People should not try to take antibiotics on their own or from friends. And I say it because it's shocking that people can get antibiotics. Sometimes I wonder how they do it.
Mm.
The thing about it is that antibiotics are not indicated in viral infections unless, and there were 2 circumstances, a physician feels that the person may be so prone to getting a bacterial infection that they give it to them preemptively. But if the physician feels that the person already has a bacterial infection because of the virus making them susceptible, then they give the antibiotic. But it's not indicated. I should just mention here that there's something that is looming called an antibiotic apocalypse. We've been overusing them. So we should really not use them for flus and things like that because they have viruses.
Antibiotics are what, sir?
Not for viruses.
Okay.
Yeah, I mean, when people don't realize that.
Yeah, for bacteria.
Bacteria only. Yes.
And also, I guess when persons have been prescribed antibiotics, they have to finish the course. They shouldn't take some.
Yes, that's another. That's a long story, but yes, they should finish the course definitely.
So just to be clear, then the home remedy stuff. What should we not do or do in that regard with home remedies? What are your recommendations there? Because you know we are in Jamaica now. Jamaicans is already bush medicine and the works.
All right. So you got it all way, but I'm not familiar with each other familiar. So I don't enter about bush remedies. So therefore I can't speak to them with much authority. But I would just say that they're not without problems. I say this all the time to people. If anything is going to do something for you, it must first do something to you. And therefore they can have side effects too. Mm-hmm. So I'm not a bush remedy. I'm not saying that fluids, hydrate, light diet, because people can get vomiting and diarrhea too,
mm-hmm.
from the flu.
Mm-hmm.
In which case you want to increase your fluids, especially coconut water. You want to take oral rehydration fluids because the diarrhea can be very weakening. Don't try to stop diarrhea in this case because you want the thing to come out.
Mm-hmm.
A lot of fluid, a lot of rest, Panadol as needed. It's a brand name, but you know what I mean.
Mm-hmm.
That's basically stay from work. Another thing which is sort of a taboo topic is masks, in case I might bring it up. If you are going to go in a crowd of people, like on a bus or a taxi or in a market or something close, you should wear a mask in this time. If somebody is sick around you, you should wear a mask. If you are sick, you should definitely wear a mask. But generally, masks are not indicated. What's indicated is a lot of hand washing and don't touch your face. People use sanitization, but people should remember, do not wipe it off immediately afterwards. Allow it to dry on your hands. But the sanitation is very important. Keeping far from people is very important. I have now been seeing flu cases. And during the pandemic, the emergency phase, I did not see any flu cases. But now we're seeing them emerging. And people should remember that it is a similar sort of taking care because it's droplet infection also. By the way, it can actually be spread before you get symptoms. So if you can have it now, and it takes about 2 to 4 days to hit you, and you can give somebody else by talking close to them before you know you're sick. So just be careful. That's all it is. Not really terrible, but have to be very careful.
And well, let me just double check. Okay, Dr. Watson still not on. Yes, it is said that COVID still a keep. And we gather that some people, when they have, particular cold, let's just say it's bad cold or bad flu. What are some of the peculiar symptoms we need to look for in terms of COVID?
So COVID, first of all, people get COVID and don't even know. You know that. Or they get mild symptoms. If it's horrible, we're debilitated, see a doctor. Because you can't move, you're coughing horrible, especially the coughing thing, and it's really bad. See a doctor. Because COVID is potentially more serious than flu. Potentially. Especially if it's respiratory problems. Go and see a doctor. There is, by the way, a treatment for flu called Tamiflu. And it is around. I checked yesterday, it is around. We don't usually have to prescribe it because most people just need simple remedies for symptomatic relief. But the thing is that flu is going around, and it's something that people shouldn't ignore.
And COVID is still around.
Yes.
That's the problem.
Not enough.
Yeah.
It is not frightening before.
Yes. The Tamiflu, Dr. Ratri, and I guess other similar medication, are there no concerns about those who are hypertensive?
No.
Okay.
Not the Tamiflu. But with cough mixtures, that's true. Be careful because some of them have something in it called pseudoephedrine. They can put your pressure up. And if you're the kind of person prone to palpitations, just use a regular DPH expectorant or something because they can certainly get palpitations with them. So the regular basic thing you get over the counter at the pharmacies, not the fancy ones.
Yeah. And in terms of the being infected, having the cold or the flu, I guess you can be reinfected over time. How should one deal with that? How do one know that this is so serious that you need to, rush to the doctor?
Okay, remember that this train that's around now will last around for a few months. So if you happen to get the flu, the real flu, and you get over it, you have an immune response. You won't get it so easily again.
Okay.
COVID was different, as you know.
Mm-hmm.
But for the flu, if you get it like the vaccine, it's like getting a vaccine.
Mm-hmm.
So if you take it, then you're immune resilient. If you get it, you're also immune resilient. So
Yes.
don't worry about getting it again so easily. I'm saying, must be kill it and people can sneeze directly and so on.
Yes.
But it's unlikely to get it twice during the time period that it'll be around.
Yes. And the whole matter of generic drugs vis-a-vis name brand drugs. Could you say more on that, please, Doc? Any concerns, commendations there? What are your views?
But remember that we're talking about over-the-counter medication.
Mm-hmm.
And if a doctor gives you something like Tamiflu or antibiotics or something, a doctor. So generic drugs are fine. They're the same things.
What's the difference? Okay, sorry, Doc.
Okay,
It just
right.
says what's the difference, really?
Right. So
Or the similarity?
brand name drugs are developed by a certain company, and they have their own way of producing it. After about 10 years, anybody can manufacture it. They may have differences in how they are made vis-a-vis the coating or something called excipient,
Mm-hmm.
which is what allows you to absorb it into your system, or how micronized it is, which makes it easier to absorb. So generally, brand name drugs are thought to be possibly superior. But nowadays, they have companies dedicated to generic drugs that do micronization, use good excipients, and good coating very well.
Mm-hmm.
So for the kind of drugs you would need for flu, it doesn't matter what you take. You have to go for the brand name for it. Don't have to.
Yes. But there are some persons, I believe, that just, it's more expensive, and there's a thinking that when things are cheaper, they are not as valuable, not as potent. Any response to that?
Yes, it is not true. It doesn't. You don't have to go for the expensive one. In fact, there's a thing in pharmacy that says they are allowed to dispense generic drugs in substitution, unless you say you definitely don't want it, because we know it's basically on par. And being more expensive doesn't mean it's going to be that better, if any better at all. Especially when it comes to the drugs you use for flu.
Yes. Recently, and I guess we're still experiencing it, the cold front that has been affecting the island. What are some of the things we need to look out for in that regard?
I'm very glad you brought that up. People seem to think that if you get a chill, CHILL, you can get a cold or a flu. It's not true. It's not that simple. People cover the mole, you know that, right? I figure, if I get a draft,
Mm-hmm.
I'm going to get but getting a chill or a draft may have problems with your immune system, which will make you more susceptible. But it has a direct effect. It's an indirect, if any at all. So getting wet in the rain, or getting a cold breeze blowing on you, or the night breeze, will not necessarily make you sick. It may problems with your immune system. Big may capitalize, and then it might cause it to be more open to getting the virus. But not a direct effect, where if you get a chill, you get a cold or a flu. That's not true.
Oh? That's opposite to what I've grown up hearing.
I know.
So what is the virus that you're saying is the main thing? I mean, you can get a draft out there, and you're okay still. I mean,
it's the only thing. The virus is the only thing. Let me mean the only thing. But like I said, some people, the immune system doesn't work as well when they get a chill or a cold weather.
Mm-hmm.
And therefore, if they get the virus, they don't fight it off as well.
Okay.
But a chill, a cold, a draft, or wetness can never give you cold or a flu directly.
When you become more vulnerable, you're saying?
That's some people, yes. That's perfectly true. Yeah.
Okay.
True.
Interesting stuff, informative. Thank you very much, Dr. Gartratri, for joining us this morning. Sir. We appreciate it.
Welcome.
Good.
Okay.
Listeners and viewers, the Morning Watch will return in just a moment.
Start your journey with a JN Small Business Loan with small business loans as little as $10,000 and up to $4 million. The time by JN Small Business Loan is
7:30.
Worship and Faith International Fellowship WAFIF presents International Death Burning and Financial Empowerment. Sunday, February 8th. Join us at 6 p.m. at 55A Old Harbor Road, Spanish Town, St. Catherine. Take along copies of your debts to be birthed and 10 things you're believing God for. Those will be prayed over and lifted up before the Lord.
There's a fire blazing outside.
Start your day informed, alert, and ahead of the curve. Join us at 6:30 a.m. for the latest breaking news, weather updates, and everything you need to know. Clear, concise, connected. It's your morning news right here on Love 101 FM, the family station. On Mondays, the morning news is brought to you by the Ministry of National Security Live Good Anti-Violence Campaign.
Can you believe it? Love 101 is celebrating 33 years of goodness, and we're excited. Join Love 101 for the 33rd anniversary celebration service. Let your light shine. Sunday, February 8th at 10 a.m. at the Filippo Baptist Church, 9 William Street, Spanish Town, with host pastor Reverend Carl Johnson, the new chairman of the National Religious Media Commission, owners and operators of Love 101 FM. 33 years of goodness, 33 years of letting our love light shine. Join us in person if you can on Love 101 Radio or our social media platforms. It's a 33rd anniversary celebratory church service, Sunday, February 8, 10 a.m. And it will be live on the family station, Love 101.
Welcome back to the Morning Watch. Thanks for staying with us. I'm your host, Dylan Toussaint. Let's now look at some news headlines to see what Jamaicans and others are saying and doing. First of all, the Auditor General raises concerns over government's Hurricane Melissa response. The Chief Justice is to rule Thursday on the Silvera manslaughter plea. The Health Ministry to face the PAC questions over UHWI, that's University Hospital of the West Indies, operations. And then PM Philip Pierre says US wants St. Lucia to stop sending citizens to study in Cuba. Interesting. Those are some of the major headlines today. Coming up next, we'll share some of the feedback from our social media question. When you start feeling flu-like symptoms, what's the first thing you usually do? We're asking you to leave a comment on our Facebook page and YouTube channel, Love 101 FM Jamaica, or WhatsApp 876-997-3125. Soon come back.
Life can feel overwhelming at times, but you don't have to face it alone. The Ministry of Counseling and Prayer of the Edgewater Baptist Church is here to support you with our caring and confidential telephone counseling service. Whatever you're going through, grief, stress, family challenges, or just feeling stuck, our trained counselors are ready to listen, pray, and guide you toward hope and healing. Take the first step today. Call us at 876-220-6474 or 876-332-7956. Weekdays between 8 a.m. and 9 p.m. Saturdays and Sundays between 8 a.m. and 8 p.m. Help is available through the prayer and counseling ministry of the Edgewater Baptist Church. Remember, help is just a phone call away. That's 876-220-6474 or 876-332-7956. Weekdays between 8 a.m. and 9 p.m. Saturdays and Sundays between 8 a.m. and 8 p.m. Call now and let us walk this journey with you.
Cause you pop straight.
On
the next mailbox, we'll be staying on track with the topic Steaming Ahead Part 2. Imagine starting your high school journey with an avalanche of financial challenges. These financial problems cause you not to have a roof over your head at times, along with a poor school attendance record and low academic results for almost 3 years. You are invited to continue the conversation with our special guest, Mr. Eric Cunningham, second-year physics student at the Michael University College, as he shares more about his divine transformation, graduating with 16 subjects and recognized with an iconic photograph atop the St. Jago High School sixth form block. That's Wednesday, February 4 at 5:30 p.m. on the family station, Love 101, the mailbox, Monday.
Wake up with the Word Box on Love FM, your morning boost from the Word of God. Brought to you by Word Intercession and Worship Center, the church where love abounds. Located at 7 Nelson Street, Maypan, Clarendon. We're on every Thursday morning at 5:45 with real encouragement and truth to start your day right. The Word Box. Fresh word every Thursday morning, only on Love FM.
Word in our hearts and the praise in our mouth. We are ready to.
Can you believe it? Love 101 is celebrating 33 years of goodness, and we're excited. Join Love 101 for the 33rd anniversary celebration service. Let your light shine. Sunday, February 8th at 10 a.m. at the Filippo Baptist Church, 9 William Street, Spanish Town, with host pastor Reverend Carl Johnson, the new chairman of the National Religious Media Commission, owners and operators of Love 101 FM. 33 years of goodness, 33 years of letting our love light shine. Join us in person if you can on Love 101 Radio or our social media platforms. It's a 33rd anniversary celebratory church service, Sunday, February 8, 10 a.m. And it will be live on the family station, Love 101. You're invited to listen to Encounter, presented by the Jamaica Association of Full Gospel Churches, every Thursday at 10 p.m. First Thursdays, the New United Bible Way Church of God with Reverend Dr. Jasmine Brown. Every second Thursday, Apostle Dr. Elaine Richards, Public Relations Officer, Jamaica Association of Full Gospel Churches, and Women of God in Service, Bogus Ministries International. Every third Thursday, Senior Pastor Fitzroy Carr, Praise Deliverance Ministry. Every fourth Thursday, Reverend Dr. Leonie Samuels, pastor at the Richmond New Testament Church of God in St. Mary. And on fifth Thursdays, Reverend Dr. Ruthlyn McClarty, Kingdom Covenant Family Church. That's Encounter, presented by the Jamaica Association of Full Gospel Churches, every Thursday at 10 p.m. right here on the family station, Love 101.
welcome back to the Morning Watch. Thanks for staying with us. I'm your host, Dylan Toussaint. Let's now join Jokal for a look at how our Facebook, YouTube, and WhatsApp friends answer today's question. When you start feeling flu-like symptoms, what's the first thing you usually do, Jokal?
All right, so we have some responses on the WhatsApp line. Let me check with, let me go to Edna first. Edna, talk to me.
Morning watch, good morning, love 101. Listeners and staff, when I first feeling this flu symptom, I draw for my own remedy, especially my onion. Slice up my onion and good morning watch, good morning, love 101. Listeners and staff, when I first feeling this flu symptom, I draw for my own remedy, especially my onion. Slice up my onion and steep it and drink it warm, slowly. And even when it gets cold, I sip it slowly also. That's what I draw for. And some other over-the-counter medicine. But I think my onion work perfectly well.
All right, thank you, Edna. And then Cherry said, on the onset of a cold or flu, take vitamins and lots of fluids and rest. Wear a mask and wash your hands properly. If these don't help, seek medical attention. We know what's going on the outside. We don't know what's going on the inside of our bodies.
Okay, those are the comments so far. Warm onion, take your vitamin, lots of fluid, and of course, rest. Thank you very much, ladies, for those comments. Well, a recent Observer report has drawn attention to a growing concern in Trelawney, where stray animals, particularly cattle and goats, have been creating dangerous conditions for motorists along major roadways. Now, these incidents have resulted in near misses, vehicle damage, and in some cases, serious injuries, raising urgent questions about road safety, enforcement, and accountability at the local level. Well, to discuss these issues we have online so far, SSP Lloyd Darby, the head of the Public Safety and the Traffic Enforcement Branch of the Jamaica Constabulary Force. Good morning to you, SSP Darby.
Good morning to you and good morning to listeners.
Yes, and congrats on your recent appointment, sir.
Thank you very much.
All the best to you. Now, SSP Darby, we mentioned a while ago in the preamble newspaper report in regards to Trelawney. Are you aware of the concerns there, and how extensive are these concerns in the rest of Jamaica?
Well, it is always a concern. Anything that endangers motorists while traveling on the road. Because in between 2023 and 2025, we have had 9 road users being killed as a result of collision involving animals. 8 instances it was cows, and in 1 instance it was a dog. And these Westmoreland accounted for 5 of these fatal collisions. St. Elizabeth accounted for 2. There was 1 each in St. Thomas and St. Mary.
Yes.
So apart from the fatal collisions, there are also a lot of collisions that cause damages, cause injury to motorists. And so it is a legitimate concern.
Yes. I understand that there were some concerns on the newest highway that we have in Jamaica there, at the Western Corridor there. What's happening over there?
You mean the North Coast Highway?
Yes. Well, yeah, to the going toward Westmoreland, I believe. Let me get my geography cleared out. St. Elizabeth end there. Yes.
Yes. Right, yes. So there's spots on it where animals will from time to time breathe the fences that are put up there. And so in the region of the last toll booth
Yes.
at toll gate, that's an area where motorists should be very careful,
Yes.
especially at night.
Mm.
So we encourage motorists to drive within the limits of their lights. You can't be going at a speed that if there is any obstruction on the road, you don't have any time to react.
Yes. And the thing is, SSP, that these animals just pop out of the dark at any time. They just jump into the road, and then by the time you see them, I gather it's too late.
That is so. And while the smaller animals, there's less control over them.
Mm-hmm.
Animal owners, larger animals like cattle, should be taking the proper precautions.
Yes.
We have a agricultural protection branch, a recently formed formation in the JC.
Okay.
Doing a lot of work.
Yeah, tell you what, SSP Darby, you're going on to something very important there as well. We're up on a break. We'll be right back to hear more on that.
Stepping confidently into a new year starts with one simple, powerful word. Yes! Say yes to new beginnings. Say yes to a secure future. Say yes to living the life you love with your family. With health and life insurance from Sagicor Life. We're here to give you the protection and peace of mind you deserve in 2026. All you have to do is say yes to what matters most. Call 888-SAGICOR to speak with an advisor today.
Hurricane Melissa may be over, but the emotional impact can linger. It's normal to feel anxious, sad, or overwhelmed. Talk about your feelings. Stay connected with family and friends and reach out for help if you need it. Call the Mental Health and Suicide Prevention Helpline at 888-NEW-LIFE. That's 888-639-5433. You can also access the You Matter chat line by messaging the word support to 876-838-4897 or at You Report Jamaica. A message from the Ministry of Health and Wellness.
Welcome back to the Morning Watch. Thanks for staying with us. I'm your host, Dylan Toussaint. And it's the second watch. We are looking at the whole matter of stray animals and how they have been endangering human beings, motorists in particular. And in so doing, we have online SSP Lloyd Darby, head of the Public Safety and Traffic Enforcement Branch of the JCF. Before the break, SSP Darby, you're telling us about some arrangement in place to deal with these things from the JCF end?
Right, so, yes, but there's an agricultural protection branch, a recently formed foundation within the JCF. So their mandate is to really protect the agricultural sector as it relates to all agricultural things. So the issue of stray animals, the issue of tagging animals, the farmer's responsibility to make sure that their animals are either in a field or securely tied somewhere, they enforce that. So there's partnership with municipal corporations for the impounding of animals. We need a lot more corporations though to institute pounds. So there are 3 active pounds at the moment, one in St. Elizabeth, the KSMP in the corporate area, one in Chapelton, Clarendon. One is being built out in Maypen, and Westmoreland is also creating one. And there are a lot of discussions with other municipal corporations to really implement pounds so that we can, in partnership with the municipal corporation, we can take these animals off the road when they are seen. So that a lot of work is done down in the St. Elizabeth area and the Clarendon area by the Agricultural Protection Branch. as it relates to impounding these animals.
So this branch was recently instituted, or it's been around for a while?
Well, the branch is a year plus into being.
Yeah.
Yes, but even before that, the police would different police formations still have the autonomy to do that work. But this branch is a national branch headed by SSP Pasco, and they're actively pursuing issues like this.
So it's a more targeted approach to the issue, correct?
Definitely.
Yeah. The matter of tagging SSP Derby, how is that done?
Right. So it is the Ministry of Agriculture that provides the tags, and then there's collaboration with the farmers and rather to get the animals tagged. It's not just for display purposes, but it's to really to
ownership
to reduce
and theft
of animals and accountability when an animal is sold, who it belongs to. So the tags identifies the animal with the owner.
So if an animal, if a cow has caused an accident or even worse, death, but it's not tagged, how is that dealt with? That's its scenario there.
That poses a challenge because, as one would imagine, if his animal, if a farmer's animal is involved like that, he will not come forward, and so a lot of investigation has to be done to know who owned the animal. Yes.
But so I'm just curious to find out to what extent you're able to identify persons in that regard, because cows look alike. How we know that is Mass Joel's cow and not Mass Tom.
Exactly, and after a collision, the identity becomes even more difficult, and that is why the program to tag the animals is important even in this regard.
What does the law say on the matter, SSP Derby? Can you give us an idea? Is there anything clear in law dealing with these concerns?
Well, as I said, the Pound Act, the Pound Act gives the authority to both the municipal corporation and the police.
Can you give us an idea what it says? I mean, not verbatim, but just a little idea what that act says in terms of, ownership of animals and them going in astray.
Right. So let me just get back to you on that. Before you finish talking to me, I'll be able to quote some.
Okay. Yes. All right. So the other end of it now, are there not some concerns with insurance and all of that with the motorists? How as far as you know, that has been dealt with over the years? And how does the police come into that area of it?
Well, whenever there's a collision, there are investigations, and the police will provide the data that is needed by whether insurance companies or the courts as to how the collision occurred. And that is why insurance companies will advise their clients to insure comprehensively, so that whatever occurs out there, then they have some coverage.
Yes. What would you advise motorists who, ill-fated situations where they collide with an animal, stray animal like that? What do you suggest they do or not do in that very instant?
Well, the first thing would be to make sure that it is reported. Don't leave the scene if it is able to be driven. Then you can, depending on the circumstances, you can leave and report it. But make sure it is reported so that the police, who are the experts can initiate investigation.
Mm-hmm.
Yes, because you're gonna need that investigative report. Even if your vehicle is comprehensive,
Mm-hmm.
you're gonna need that report from the police to be compensated.
And they should take pictures and all of that if possible.
Definitely, that is always recommended. Whatever the cause of the accident, you know, a picture tells 1,000 words.
Mm-hmm.
It's always advisable.
And in terms of don'ts, those are some of the do's you mentioned. What about the things that they should not do that over the years you have come across people doing it and it is a no-no?
You mean specifically in relation to collisions with
Yeah,
animals?
with animals, yeah. I mean, some people take out the cutlass and start to do something with the animals. Is that a no-no?
That is a no-no. That is a no.
And why?
That is a no-no. Leave it to the authorities. Remember, even there's a process of animal meat being recommended for use for consumption.
Mm-hmm.
So there's always a process where the health inspector has to test the meat before you consume it.
Mm-hmm.
So you might end up having a collision,
mm-hmm.
and then endangering yourself, family, friends, whoever you share that meat with.
Mm-hmm.
So it's advisable not to do anything like that.
Yes. And back to the driving now. You know, road users. I don't know. As we said earlier, it's difficult to preempt a situation like that. But especially on these, because I gather that a lot of it happens on the highways, right? And you know, if you are driving at a certain speed, you know, that you would not normally be driving in the towns in traffic. You know, what is your recommendation to these motorists, generally speaking? Anything else you want to share there, you know, driving on these highways especially?
Well, the general information that the police wants the public to hear and to adhere to is to drive at a speed that gives you good reaction time, and drive according to the conditions of the road.
That sounds subjective though, SSP. I mean, who determined that? How do we know that we're driving at a speed that is based on what you just said?
Right. So that is so the driving habit have to be developed by persons. Persons have to realize that the faster you drive, the less time it takes to stop.
Mm.
If there's a collision, the greater the impact, the greater the injury.
Mm.
And so, while we always have to commute on our road, it must be something that we'll leave on time, so that we are not forced by circumstances to hurry.
Yes.
And then, even if you are in a situation that you are late, you have to weigh the consequences of being late with the consequences of being involved in a crash.
Yeah.
So we have to develop that system as road users.
Yeah.
Of driving defensively, and really surviving on our roads.
Yes.
Because we for the last 10 years, we have lost 4,107 persons on the Jamaican road to road collisions. For the last 10 years, we have not gone below 300 persons being killed in a year. The best year we had was in 2016, when we had, I think it was 322 persons being killed. Last year, it was 374. And it was 9 more than the 365 that were killed on our roads in 2024.
Yes.
So the message has to be that while there are a lot of environmental factors, animals on the road is one environmental factor. There are many others. Many roads have poor lighting. Many roads are very slippery.
Yeah.
When we think about the roads down in Trelawney, from Braco right into St. James. You look at the road is white, it is slippery. And even since the start of this month, we had, on Saturday night, we had a fatal crash.
Yes.
And then on Sunday morning, just hours after,
yes,
we had 2 persons dying
yes,
on that road in a crash.
yes.
And it was in the rain, and you could attribute that to the person losing control because of the slippery road and because they were going too fast.
So
you have to drive.
Yes. So I guess
according to the conditions of the road.
Yes, I guess the moral of the story, not because the speed limit is say 110, you have to drive 110 miles per hour.
Exactly.
Yeah.
The authorities are not saying that this is the speed they must drive.
Yeah,
They're
right.
saying this is the speed that you must exceed.
Well said. Well said. SSP Darby, thank you so very much for joining us this morning. And I said a word to the wise is sufficient. We hope that persons have heeded your caution. And all the best again as you take on this role as head of the Public Safety and Traffic Enforcement Branch of the JCF.
And thank you very much for having me.
Great. Thank you, listeners, for being with us. Join us again tomorrow as we continue to set the stage for a discussion of topical and controversial issues. For information and how to get copies of this program, call our production department at 876-968-959627. This has been the Morning Watch. Thanks to our producer, Yashika Nevers, and our guests. I'm Dylan Toussaint, returning you to Love in the Morning.